So this is the first of 5 policy and advocacy information sessions for this week of Children's Advocacy Week. So it includes advocates across the state, and each one we worked with regional partner co-hosts to help drum up attendance and get folks from that region to join. So this is a Western Kentucky session. So it should be a good mixture of advocates and different folks from across the state as well.
Okay, when you see me on my phone, I'm not multitasking. I actually take notes on my phone, so don't everybody panic that I'm divided interest or anything. I can't carry a notebook. It's pointless. I lose the notebook almost as soon as I try to carry one, but I always have my phone. It's like attached to my hip, so that's my notebook.
Very modern.
Well, it's desperate is what it is, because seriously, I've got like 8 notebooks somewhere between here and Frankfurt. They all have notes in them, probably some important notes, and I can't find them. So I've gone to this.
Nothing like the cloud to keep you all together, right?
Right. I would be worried about what the cloud has and can get accessed by somebody, but my notes are usually so boring that have at it.
Right, I think I'm going to let folks in from the waiting room, so you should see some faces pop up on screen. Hello, everyone. While we're waiting for everyone to join, please use the chat feature to say hello. You can drop your name in there and say who you are and who you're with. All right, we'll wait about 1 more minute before folks to hop on and join, and then we'll get started. All right, we'll go ahead and get started. So thank you all for joining us today for our first policy and advocacy information session this week. I am Kelsey Dimar with Kentucky Youth Advocates. This is one of 5 similar events we're doing throughout the week. Not all of the events will be streamed on Facebook Live like today, but we still encourage advocates to tune into these sessions throughout the week on Zoom to hear from regional partners and legislators. So during today's forum, we ask that you stay muted, but we are taking questions and comments via the chat feature, and we'll try to answer those as we go, either in the chat or afterwards in a follow-up email. So today you're going to learn more about the Blueprint for Kentucky's Children policies and hear from Representative DJ Johnson of Owensboro about the 2021 General Assembly and why we need you to take action on behalf of Kentucky kids. So I am now going to turn it over to our partner co-hosts to introduce themselves and share a little bit about their organizations. Amberly, do you want to kick us off?
Sure. Okay. Hello. My name is Amberly Haverstock. I'm the Community Impact Director with Lotus. We are the Children's Advocacy and Sexual Violence Resource Center here in the Purchase area region of Kentucky. Lotus's mission is to support survivors, to strengthen families, and to empower communities to end child abuse and sexual violence. And this year we will improve safety, healing, and justice outcomes for over 1,500 survivors and their supportive family members. We are committed to ending child abuse and sexual violence, and this year we'll engage thousands across our region through that prevention education, outreach, social justice advocacy, with the goal to create safe, equitable, just communities where all children and families thrive. And so we're really happy to be able to host this forum today with our other advocates for children across the state. And we really advocate for children because I think you all agree that children deserve to feel safe in their bodies. They deserve to feel safe in their homes and in their communities. And we can all play a part in creating those safe and stable and nurturing environments for children to learn and to grow. And Lotus, it really encourages everyone to get involved because all children and families deserve that opportunity to hope, to heal, and to grow. So thank you.
Thank you so much, Amberly, for joining us. I'll now turn it over to Erica Wade.
Hi, I'm Erica Wade. I'm the Executive Director of the Center here in Owensboro, Kentucky. And at the Center, our mission is to provide caring connections for children and families in our Owensboro and Davis County to ensure that everyone in our community has access to the resources that they need to thrive. So we do that through resource referral services, through our Supervised Family Visitation Center, family outreach, which includes parenting classes, one-on-one parent coaching, and professional development throughout our community. We do community outreach, providing a community resource directory and launching projects as needed, such as a church collaborative and different community initiatives. And we also are now going to be offering therapeutic services, offering parent-child interaction therapy and individual, family, and group counseling for our populations that we serve. We're just very blessed to be in a county where there's so many tremendous services, and really, it's an honor for us to just provide that hub and to provide that space where we can pull these people together to really make a difference for children and families by working together to move the needle on these issues. So thank you so much for letting us be a part of today and always keeping us up to date on all these policies.
Great. Thanks so much, Erica. And last but not least, I'll let Rosemary.
Hi, everyone. I'm Rosemary Condor. I'm the Executive Director of CASA of Ohio Valley. We serve Davis and McLean County, but you will find that CASA programs are all across the Commonwealth and all across the United States because we serve children in a unique position that have been involved in the court system through abuse and neglect. Not anything to do with the children. They're completely innocent. And so what we see, the importance of Kentucky youth advocates and this week is so important because we as a community and as a state can come together to make positive changes for these children and their families. We know that we're seeing generational abuse and neglect and family dysfunction, and that it does really take a village. And I think the Blueprint for Kentucky's children and our legislators being supportive of all of the initiatives really shows the bipartisan effect of hearing across the aisle that children really do bring people together. And I really feel like that this is such a wonderful opportunity to be part of this, and we're really grateful to be able to share our mission with you, but also so excited to learn more about how we can come together to make a difference in the lives of our Kentucky children.
Great. Thank you so much, Rosemary. And thank you to Amberly and Erica as well for your introductions and helping us kick off Children's Advocacy Week. So just to get our brains going and to give us an opportunity to connect with one another, we're going to go through a series of polls. So in 1 minute, you'll see some polls pop up. So the first is approximately how many kids live in Kentucky? I'll give it a couple more seconds. All right, the polls have closed, and let me share the results. So the correct number is over 1 million. So based off 2019 Kids Count County Data Book numbers, there are 1,275,481 kids in the state of Kentucky. So the next poll is all of you today are advocates for kids. How long have you described yourself as an advocate for kids? We have a lot of veterans on the call, more than 10 years. That's the most answer. All right. I'm going to end the poll and I'll share the results. So it looks like we have a good mix of folks on the call. The most was more than 10 years. So we have a lot of folks who have been around for a while advocating for kids. All right. The next question is, how many children's advocacy days have you attended in the past? And feel free to drop your first children's advocacy day in the chat feature. So if you attended back in 2016, feel free to drop that in and tell us the first year you attended CAD. So we have about 21 folks who this is their first children's advocacy day / week. And then some folks have been around for, who have attended at least 5 children's advocacy days. All right. And then the final question is, what advocacy action are you most proud of? And feel free to elaborate in the chat. Give us some details if you wouldn't mind sharing. All right. So being there for a child when they are struggling was the most popular answer, and then built support for policy change among kids, friends, family, and colleagues. Okay. So now that we've participated in some polls, I am going to turn it over to my colleague, Alicia Whatley, to share more about the blueprint and this year's policy priorities.
Thanks, Kelsey. So thanks everyone for joining us today. As she mentioned, my name is Alicia Whatley, and for those who I've not met or don't know me, I am a member of the KYA policy team, and I mostly focus on health policy. But today I'm just going to go over several different things about the blueprint, and just kind of an overview of what the Blueprint for Kentucky's Children is, and then also talk about some of the policies that are on it this year. So we'll talk first about policies that have not yet been filed as bills, and then I'm going to move into, or then we'll move into the ones that have been filed that you can go ahead and follow along and take action on this year during the General Assembly. So first, just a little bit of background about the Blueprint for Kentucky's Children. For those who are not as familiar, the Blueprint is a coalition of over 100 statewide partner organizations. So that includes like our hosts today, as well as a lot of the attendees today and throughout this whole week. So they are representing nonprofits, public and private organizations, and they speak with a common voice to create a brighter future for Kentucky's kids. And then every year that coalition has a policy agenda of what we're focused on and what are the policies that we're going to be following. So the blueprint stands on 3 pillars, which you can see here are thriving communities launch strong families launch successful kids, and successful kids launch a prosperous future for Kentucky. So as the Commonwealth works to overcome the impacts of the COVID-19 pandemic and address systemic racism, these policy priorities can be implemented during this General Assembly in 2021 without being included in the state budget. So first, we're going to go over the policies that are not yet filed as bills. So the first one that we have is to extend the statute of limitation for misdemeanor sexual abuse cases involving minors. The current statute of limitations expires 5 years after a victim's 18th birthday. But if this bill were to be filed and passed, it would actually extend that to be 10 years after the victim's 18th birthday. The second one is to eliminate the clergy penitent privilege exemption from the child maltreatment reporting law. So this is to ensure that any disclosures or suspicions of child abuse and neglect are reported to the proper authorities and that they are not exempt from those reporting guidelines. And the next one is to eliminate the chain of command reporting procedures that often exist in public and private agencies from the child maltreatment reporting law. So what we have seen is that sometimes the internal policies mandating that workers actually report disclosures of abuse to their supervisor, and then the supervisor will open an internal investigation before reporting it to DCBS or to the police. And so this bill is really aimed to make sure that whoever received that disclosure actually is required to report the disclosure, as well as their internal procedures that they would follow. And then the next one is to establish a minimum age threshold for when young children can have complaints heard in court. So currently, children of any age in the state of Kentucky can be complained on and then have their complaints heard before a judge. So in 2020, the youngest child that this happened to was 8 years old. And so we just want to make sure that there is a minimum age established, and then that would increase opportunities to connect these young children to community-based resources instead of sending them through the juvenile justice system, which we know can be so hard to get out of. So we don't want them entering at such a young age. The next one is to minimize the impact of parental incarceration on children by holding their parents accountable in ways that prioritize substance use treatment and community-based alternatives to incarceration for certain offenses. So right now we have the third highest rate of parental incarceration in the country. And so we know that there are thousands of children in Kentucky that are negatively impacted by their parents being incarcerated. So this would give another option to hold their parents accountable. The next one is all about childcare and how we can have more options for childcare facilities, as we know that Kentucky has many childcare deserts across the state, and we know that this is a huge issue following the COVID-19 pandemic and the ongoing effects of that. So this would be to amend the local planning and zoning laws to allow regulated home-based family childcare options to safely serve children in their own neighborhoods. So regulated home-based family childcare options are a much needed choice for working parents and for local economies. In the past 10 years, Kentucky has experienced a dramatic decline in the number of family childcare home providers that we're seeing. And one big reason for that decline is the planning and zoning requirements that go into an in-home business. So this would just give more options and make it easier for people to get licensed and remove some of the burdensome requirements that are currently in place. So those are all examples of policies, or those are all policies that are on our blueprint this year, but are not yet filed as bills. So there's nothing to follow with those in the legislature right now, but hopefully they will be filed soon. And I'm going to turn it over to Patricia, who's going to go over some of our blueprint policies that have already been filed.
Thanks, Alicia. So that was an overview of other blueprint policies. So as Alicia said, there are several policies that have already been filed by legislators. And so we really want to draw your attention to those. Those would be great ones concrete ones to reach out to your legislators about this week. So first of all, we have House Bills 42 and 52. Which are sponsored by Jason Nemus and Josie Raymond. These bills would allow state employees to access 12 weeks of paid family leave after the birth or adoption of a child. House Bill 42 is filed by Representative Nemus, 52 by Representative Raymond. And so wanted to point out that one is a Democrat and one's a Republican. So this is a bipartisan support for this concept of paid family leave. And we know that paid family leave allows families to be there for the important first moments in the lives of their children, and knowing that their employment is secure. It has proven short-term and long-term health and well-being benefits for families, as well as proven returns on investment for employers. And we also know that currently Black and Hispanic workers are less likely to have access to paid family leave than people who are white. I think this is particularly relevant during this pandemic, where we all are concerned about having access to healthcare needed if we get sick. So improving access to this benefit would boost family and economic stability for all eligible families. And we think this is a really good first step when it comes to adopting paid family leave. Another bill I'd like to draw your attention to is House Bill 147. This would allow city and county governments the option to regulate the use, display, sale, and distribution of tobacco products, including e-cigarettes. House Bill 147 is filed by Representative Kim Mosier, and it's co-sponsored by Representative Tina Bojanowski, which again, this is a bipartisan bill. Additionally, there is a companion bill. So its exact same bill is filed in the Senate by Senator Julie Rocky Adams, and that is Senate Bill 81. And the reason that we think this is so important for kids is that city and county governments see firsthand how effective tobacco control policy can improve health over time. And we know that those local communities, local governments can respond more quickly to local needs. They have the ability to tailor ordinances to meet those needs and develop effective enforcement measures. But currently a state law prohibits, or it's known as preempts, local jurisdictions from enacting stronger tobacco control measures to reduce tobacco use. And we think that these local communities need those tools in their toolbox when it comes to reducing tobacco use among our youth. So some examples of those local control tools could include maybe setting standards on tobacco retailer density in neighborhoods, or setting buffer zones between tobacco retailers and schools or playgrounds. We know that children are more likely to use tobacco products if they live or go to school in a neighborhood with high tobacco retailer density. And tobacco retailer density is higher in urban neighborhoods with higher percentage of Black residents, and low-income neighborhoods. And this means that kids who are low-income or Black are disproportionately at risk of using tobacco. And so we're excited to see these bills filed and hope that you all will reach out to your representatives in support of them. Next is Senate Bill 36. This is sponsored by Senator Whitney Westerfield from Western Kentucky. This would allow juvenile court judges to use their discretion in the decision to transfer youth ages 14 and older to adult court for situations involving a firearm. Senate Bill 36 has been assigned to the Senate Judiciary Committee, and we're hopeful it will get a hearing soon. And the reason why this is a blueprint priority is that currently statute or state law states that anyone who is at least 14 and in possession of a firearm during the alleged, so even if they're alleged commission, not proven guilty of a felony, they will be charged as an adult. And this is even in the case, the gun doesn't have to work, doesn't have to have been discharged. And the child doesn't even have to be the one in possession of the gun. If there's more than one person there and that person has the gun, they'll be held to the same standard. And in any other instance, judges have full discretion when deciding whether a case should be held in juvenile or adult court. And they use a list of factors that could include the seriousness of the offense, the maturity of the child, whether it impacts public safety, what's in the best interest of the child and the community. They could consider the child's prior record and a few others. But currently, if the firearm is involved, they have none of that discretion. So if this bill passes, judges will be afforded the same discretion in cases involving firearms as they are in every other case, which we think is very important because we know that kids are not just little adults. They need to be treated as kids. They deserve that protection from us. So next, House Bill 192 is the big kahuna. It's the state budget. So we are very closely paying attention to that. We hope you are too. As you know, we pass a state budget every 2 years in Kentucky, but due to the pandemic, last year they passed a 1-year budget. So this year we have to pass a budget again. And currently those efforts, that process is in play. So House Bill 192 is the bill that would enact a continuation state budget that, among other things, will impact child health coverage and care, education, and safety. It's sponsored by Representative Jason Petrie, who's the chair of the House Appropriations and Revenue Committee. So the Kentucky House and Senate have both passed House Bill 192 and have now appointed members from both chambers who will participate in a conference committee to negotiate the details of the state budget before the final gavel in March. So stay tuned. We also invite you to review the Blueprint for Kentucky's Children budget and priority checklist, which is going to drop in the chat, I believe. Or actually, it's going to be there in the slide, but right in front of you. So some things that we wanted to highlight that we are going to be paying attention to in the budget are, we think it needs to promote student success, health, safety, and well-being. We want to invest in infrastructure to close the digital divide. We know that access to broadband is incredibly important, not only for attending school right now, but also being able to visit the doctor via telehealth or your therapist. So Kentucky's currently 40th in broadband access. We need to, now is the time to invest in closing that gap. We want to make sure that school districts have necessary resources to implement the expanded care services policy, which in a nutshell is helps schools give resources to provide mental health and behavioral health supports to students, which we know are incredibly important, especially these days. And we want to make sure as schools reopen and kids come back into school that they have the tools at their disposal to help kids with that. And we want to sustain investment in our family resource and youth service centers, our FRISKIs, which are very vital to the well-being of our kids. We'd also are hoping to see that the legislators prioritize kinship care and sustain investments in critical services and financial supports, such as respite care and the relative placement support benefit, which relatives are eligible for to help meet the financial needs that come when they take in their relative kids. We also want to strengthen Kentucky's efforts to prevent child abuse and neglect. We unfortunately rank very high as a state. We're at the top of the list with the incidence of kids being victimized by abuse and neglect. And we think it's very important, being at the top of that list, that we have preventive services in place, which include the programs like K-STEP and START, which help address those core issues that parents are facing that keep them from being able to be together with their kids. We'd like to see investments continue in home visitation programs, which are highly successful, such as HANDS. We also want to see new investments in forensic services for children who experience maltreatment. There are some special pediatricians who serve kids who've experienced abuse and neglect, and we need to be investing in making sure that we've got, for every child that experiences that abuse, that they're able to receive those services. And we need to see continued investments in our basic safety net infrastructure to meet families' basic needs, including KTAP, the Child Care Assistance Program, and SNAP, which is the Supplemental Nutrition Assistance Program. And I think that's the run through of things that are currently at play. Be on the lookout. We expect to see more bills filed this week. And now, without further ado, I am going to transition to Rosemary Condor, who is our lovely board member and partner at CASA, to introduce you to Representative DJ Johnson.
Gosh, thank you, Patricia. Thank you, everyone. Really excited to have Representative Johnson with us today. I just have to say, we're really proud that he's from Western Kentucky. He's from Davis County, but he is a Kentucky son. He has served our country, and we thank him for that in the military for more than 11 years and in Washington, D.C. And we're very grateful for his service to our country. But we're also so grateful that he chose to come back to Kentucky, back to Owensboro, to represent Western Kentucky in the legislature. I know that he is a champion for children, and he has always been very supportive for any issues that affect kids in our community. His wonderful wife, Ellen, and his 2 pups, really, we see him around town a lot. He's involved in so many local issues and always such an advocate for our kids and nonprofit work. So we're very grateful for DJ being with us today. Even though he's windblown and in a Western shirt, we'll take him.
Go Hilltoppers. Thank you, Rosemary. And I want to thank everyone that's here today taking time out. Basically for me to get educated. And I will say that when you asked how many years you were an advocate for children, I put 1 to 5 simply because I am a little new to all the issues that you've brought up. We had a Zoom meeting several weeks ago. It seems like several months ago. I don't remember when it was, but you provided a lot of information to me then, and I've identified or found out that the statistics that you guys have available is very helpful when I'm trying to make decisions about legislation. So I want to say hats off to you guys for all that you're doing, because you're doing good work and you're helping guys like me who maybe don't know all the issues that you deal with get a little more educated so we can be a little more effective. I did have a question from the things you talked about. Can somebody discuss with me home-based family child care options? Is that a home-based child care for family members, or I just want to get my terminology, make sure I know what I'm looking at there.
Sure, I'll jump in. So that is a case in which an individual cares for up to 6 unrelated children. So they could have their own children, but it's bringing in other kids.
It's not just family members, it's a combination, it's a hybrid.
Yeah, or it could be none of their family members, but it's up to 6 unrelated children.
Got it. And I think that's a great thing if people are willing to invest their time, but they don't want to do a fully regulated child care facility. It's people helping people. So that caught my eye. I thought that was a great program. I guess the best thing for me to do is talk to budget just a little bit, and I can give you, first I have to preface saying that I don't have access to what details the conference committee is discussing right now. But I will say from the conversations we've had, discussions we've had, I would say the goal for this budget is to basically maintain a holding pattern, because we typically would have a 2-year budget. We wouldn't even be doing this, but we were concerned about COVID. So the purpose of this interim budget is simply to make sure that we've got any emergencies covered and not to recreate a brand new budget compared to what we have from last year. So programs that you have in place now, I would anticipate would continue to be funded based upon what you saw from last year. I don't know there will be a lot of new funding for anything, because again, our goal is to make sure that we're safe, or we've done everything we can with respect to COVID, follow the budget process that we had from last year, and do the formal budgeting process next year. So there's a little bit of good news and a little bit of bad news in there. If you're looking for new programs, not sure you're going to see those. If you're concerned about cuts, I don't think that'll be a big problem either. So, and I guess I'll just say personally, I'm excited about getting more involved with what you guys do. It started with, I put a little thing in the chat. It started when I got involved with Mentor Kids Kentucky. I'm mentoring a 13-year-old young man that I'm thrilled to be working with. And it opened my eyes a little bit. And then I became involved with adoptions and foster care issues the last time I was a legislator. For those of you that don't know me, I've been called the red shirt freshman, one of the 2 red shirt freshmen for this session because I was a freshman a few years ago, didn't get reelected, then got reelected, so I'm a freshman again. So I call myself a red shirt freshman. I guess that's why I got my hoodie on today. So, boy, that's a long way to say that I'm new to wanting to help out with childcare issues and children advocacy issues. But I'm excited about doing that. And it really started with seeing what I call crazy adoption process that we have in this state. And then also that led to foster care. And this is leading more to me understanding more about what you guys got going on. So I'm a sponge. Just let me soak up your information. I'm available to anybody that wants to talk about anything, and be willing to help in any way that I can. That's a very long comment there, but I'm pretty excited about what you guys are doing, and it's new to me. So thank you very much.
Thank you, Representative Johnson. We're so grateful to have you with us today and have you be available and accessible to us, because we feel like the more education that the legislators have about Kentucky's youth advocates, the issues, the blueprint for Kentucky, the more support that we can get and the more we can move the needle for these kids. And I know you've always been great about reaching out and saying, tell me more about this, help me understand it so that I can make an informed decision and a good decision for Kentucky's kids. So we're really grateful for you, having you in our corner, even as a freshman. We know you've got a big career ahead of you, so we expect big things from you.
Well, thank you. Appreciate that.
Representative Johnson, one question we have is, we always like to ask is, what's the best way for people to contact you? How do you like to hear from your constituents?
You can reach me at my email, my LRC email. I don't mind that. It's dj.johnson@lrc.ky.gov. I'll type that in over here too. But I don't mind you reaching out to my personal email account, and that's djjohnson7500@gmail.com. Going through the LRC is a step. There may be an additional step before it gets to me. If you come straight to my personal email, that's fine with me. I'd appreciate it if I'm not really interested in getting a bunch of spam at my email, so I don't need group tech or group emails, but anybody who wants to talk to me about something one-on-one, I'll be glad to try to do that with you. And that's the most direct way, probably.
Maybe one more before we let you go. What are your priorities for kids this year?
Got me typing. Again, I've really been focused on the adoption and the foster care issues. Now, we put an adoption bill through that the Speaker Pro Tem's co-sponsored when I was a freshman, and I think we're going to have to tweak that some. So I'm still focused on those areas. I know you've got an entire list of bills that you're working with. I'll follow those, support everything I can. But anything that deals with adoptions is going to get my attention.
And I guess if we could just have you, one last comment we'd like to hear from you is kind of give the folks a sense today on this call. I know you said you're as a redshirt freshman, so you've been around the block before. What can we as advocates, how can we do our job most effectively? And you know, when you hear from your constituents, what impact does that make? Why does all of this matter?
That's a great question. I'm just going to be brutally frank. When I get hundreds of emails that have the same exact text in it from people that aren't my constituents, it doesn't really get my attention. I just straight up be honest with you, and I think that's true with most other legislators. But when I hear from a constituent, someone who's in my community, and it's not just about them being able to vote yes or no in an election for me, it's the people that I see at Kroger's or something like that. When they reach out to take time to give me a personalized individual email, that gets my attention more than just about anything else. even as so far as calling into the LRC and leaving a message for me has less impact than someone who reaches out to me and takes the time to write something personal, and they're from my hometown. I generally get back to them as quick as I can, and it catches my attention more than anything else. So what I'm saying to everybody that's on this Zoom meeting, if you want to make the biggest impact with the legislators, contact your legislator personally. And most of them will be willing to even sit down and have a meeting with you if you want. But certainly they'll have a phone call with you or exchange emails. That's your best bet. And be specific.
Thank you for that. And I'm gonna, so I see your email is there in the chat. I encourage everyone, especially if you're a constituent of Representative Johnson, to reach out, take him up on his offer, share those personal stories of how it's impacting you.
Let me just expand on that for just a minute, just so you know why I said what I said. In the last 24 hours, I've gotten 200 emails in my LRC account. Probably 150 of them are form letters that either a group has been told to send to me or one individual is just spamming me. That's just not effective. It's just not going to, I'm going to look at about 3 of them, realize what they are, and move on. But when I see something from someone who's actually taken the time to write, it's a different world. It's a different impact. So I just want to make that absolutely clear. I'm not trying to say it's not important to reach out to all the legislators, but I know what's most effective.
There is there's a question in the chat box that just popped up and said if someone wanted to send you something, should they use your home address or where you work?
I've actually got a PO address, and I'll type this in too, but if you want to write it down, it's DJ Johnson. It's PO Box 6028, Owensboro, Kentucky, and the zip code is 42302. That comes to Owensboro, but it's kind of my work mailbox, and that's the best way to get me. I check it on a regular basis.
And the other question I have is you're the representative for District 13. What does that cover besides part of Davis County?
Well, it's primarily the city of Owensboro. It's not 100% of Owensboro. It's very close. And then what I call slivers of Davis County. I actually share the county with 4 other reps. So my basic answer is almost all of Owensboro and slivers of Davis County.
So you'll put a bug in the ear of the other legislators when Owensboro says that we need something? Yes?
Yes, count on that.
Well, thank you so much, Representative Johnson, for joining us today and sharing your wisdom and insight. We really appreciate it. And thank you for sharing that information in the chat feature. And I echo what Patricia has said to follow up with you with, policy and solutions for kids. So thank you again for that.
All right, thank you. And I'm going to drop off. I don't know if you've got other business you need to take care of. I'll drop off and you can do whatever you need to do.
Well, feel free to join if you want, but we're winding down.
Oh, okay, good. I'll stay on then. I don't want to.
Yeah, so as we wrap up today, we wanted to take a minute to hear from the Children's Advocacy Week signature sponsor, Aetna Better Health of Kentucky. As some of you may have heard, Aetna Better Health is now serving all kids in state care through the Supporting Kentucky Youth Program. We have a short video from Aetna Better Health with more information.
Hello, fellow advocates. We are so excited that it is Children's Advocacy Week. We are delighted to be with you here today. I'm Kelly Poland. I'm the Executive Director for the SKY program here at Aetna Better Health of Kentucky. And at Aetna, we are so excited about this week and really excited about the rally because that's when hundreds and hopefully thousands this year as we go virtual will come together to show our collective support for Kentucky's kids and families. We also know there are not a lot of event opportunities for our kids to share the same stage with Governor Beshear and our House and Senate leadership. Aetna knows there's no better way to make connections with advocates who care about kids than this week. And an event like this is especially important this year, given the pandemic and the systemic inequities that we see, particularly with our vulnerable kids and families in the state. And furthermore, Aetna Better Health is honored this year to support the critical work that we know Kentucky Youth Advocates does to help the Commonwealth in their commitment, again, to meet the needs of our children and family in the state. This year is extra special for us at Aetna because we were selected to manage the state's new Supporting Kentucky Youth program, also known as SKY. And this really means that children and youth in out-of-home care, including former foster youth, youth who are placed in kinship or relative placements, Medicaid eligible youth in the juvenile justice system, and children and youth in out-of-home care and adoption assistance youth began receiving their Medicaid coverage through Aetna starting in January. And in addition to covering Medicaid benefits, we are going to be providing a high-touch approach to care management for this population. And this really helps children and families navigate the systems and make it easier for them to get the resources that we know that they need. Our care management team is going to be helping Kentucky's children and families find local providers, schedule appointments, and even help these members get rides to and from their medical appointments. And we will also be providing extra bonus benefits like cell phones, laptops, and wireless plans to some youth so that they can maintain those very important connections to their support system. Members in SKY can also get other extra benefits to set them up for success, like GED prep classes, job training, life and financial skills coaching, and much more. Plus, we offer a few other helpful extras like our duffel bag program that's full of essential and fun items and a surprise birthday box that includes, well, we don't want to really ruin the surprise for you all. In addition to these extra benefits, we will be working really closely with the families that our youth and providers and others who are involved in these children's lives work with so that we can help equip them with the tools they need so that together we can achieve the best possible outcomes. We will be providing free training to the stakeholders that are in the child welfare and juvenile justice systems. Some of our free training includes a trauma-informed care overview, which really provides an overview of the components of trauma-informed care and the impact of adverse childhood experiences. And another training I get really excited about is our Human Trafficking 101 training. In this training, we're really helping our participants understand what human trafficking is, what resources are available, and help them learn how to meet the complex behavioral health and support needs of this population. If you are interested, upcoming events and opportunities like these that I just mentioned will be online at www.aetnabetterhealth.com/Kentucky/event. Finally, I just wanted to mention one of the most frequently asked questions that we've been getting as we're implementing this new model here at Aetna Better Health with the state of Kentucky is really about existing relationships with providers who are not enrolled with Aetna. The SKY program is really focused on engaging our members and their networks of support. And we really appreciate the importance of SKY members' established relationships with their providers. So we would like to help maintain that relationship so the SKY eligible youth can access all of these wonderful supports and services that SKY offers, but also still maintain that invaluable relationship with their providers. So we want to let you know that caregivers or providers can reach out to us directly and reach out to our SKY provider relations team to get enrolled in our network so that the providers can continue to see our members. Our contact information is going to be on a one-pager and in our mobile app, and we will be sure to share that with you. I'll drop our phone number real quick. It's 1-855-454-0061, or reach us by email at kyproviderrelations@aetna.com. And there's no need for a special contract to provide services to Sky members. All participating Aetna Better Health of Kentucky providers are available to see our Sky members under their existing contract with Aetna. Again, we're so excited and honored to be partnering with KYA and to be partnering with all of you. I am certain that we are going to have a very powerful Children's Advocacy Week. Thank you for this opportunity to spend some time with you today.
All right, so what do you do with all this information? We encourage you to take action on behalf of Kentucky kids and contact your legislators. So make sure to access our tools to stay connected. If you haven't already, please download the Children's Advocacy Week app, which houses the schedule for the entire week with Zoom and Facebook links. Other helpful documents like our Blueprint for Kentucky's Children policy fact sheets and more. You can also go to our YouTube page to access recordings after each of the events. Be sure to follow us on social media. And lastly, if you don't know who your legislators are, use our legislator lookup tool to find out and get their contact information. So thank you so much for joining us today, and a special thank you to Representative DJ Johnson for taking the time to talk with us. We know that you're extremely busy, so we really, really appreciate it. And thank you again for our partner co-host for helping to talk to us today and also help promote the event. So have a great day, and we look forward to seeing you at other Children's Advocacy Week events this week. So thanks again for joining us.